This is Yannick Ryring of Empire Surgical, and today I will be going over the basic steps of a rotator cuff repair. Now I'm going to divide it up into four major parts: the portal placement, the initial diagnostic arthroscopy, the preparation for the repair, as well as the repair itself, which I will subdivide into anchor placement and suture management. Now starting with portal placement, we have our posterior portal, which will be our viewing portal. We have our lateral portal, which will be our working portal, and we have an anterior portal, which will be our utility portal and will also help us with suture management. Moving on to the initial diagnostic arthroscopy. We're going to enter our joint space through our posterior portal, going into the glenohumeral joint space. We're going to identify common anatomical landmarks such as the humeral head, which is the articular cartilage, the glenoid fossa, glenoid labrum, as well as the biceps tendon, which attaches at 12 o'clock on the labrum. Now after we're done the glenohumeral joint space, we're going to enter the subacromial space through our lateral portal. Once we're in the subacromial space, we're going to perform a complete subacromial decompression consisting of a bursectomy and an acromioplasty. So for the bursectomy, we're going to use a vapor, and we're going to remove any of the bursa that sits on top of the rotator cuff. The next thing we're going to do is we're going to use a burr for the acromioplasty, and we're going to smoothen the underside of the acromion to get rid of any bone spurs coming down from the acromion. Now ideally we want to have space between 5 millimeters and 7 millimeters because that will give us the best visibility, operating space, and it will relieve the patient of pain coming from impingements from the acromion. Now the next thing we're going to do is we're going to identify our tear. So we're going to use a grasper, and we're going to pull down the supraspinatus tendon over the humeral head to check its mobility. If you're in the subacromial space and you can look straight down on the humeral head, that is usually a great indication for a rotator cuff tear. So the next thing we're going to do is we're going to identify our tear, shave down any fibrous tissue that might be coming off the tear, and we will create a bloody bed on top of the humeral head, which will promote healing once we tack down the rotator cuff, because we want the most bone-tendon interface to get the most anatomical repair possible. So the next thing we're going to do is we're going to move on over to our repair. So anchor placement is first. We're going to introduce our first anchor on the articular margin. So we're going to do a medial row fixation and a lateral row fixation. For medial row fixation, we'll place our first anchor anteriorly on the articular margin. So we're going to use our universal helix awl. We're going to mallet down to the first laser line, 4.5 millimeters. We're going to introduce our anchor. We're going to pass suture anteriorly to posterior using our espresso. Once we have pulled all our, so we're going to use a macro stitch. So we have both limbs coming through the rotator cuff. Now once we pulled all the sutures from our first anchor, we're going to introduce our second anchor into on top of the humeral head, posteriorly on the articular margin. Again, we're going to pass suture anterior to posterior using our espresso. So what we're going to end up with is 8 suture limbs coming out of your anterior portal. Now, in order to organize them, we're going to create 4 pairs of suture, 2 blue pairs and 2 purple pairs. Now, those pairs we will tie 4 knots on top of the rotator cuff. And we're going to tie those knots posteriorly to anterior. So how it's going to look in the end is we're going to have 4 knots sitting on top of the rotator cuff. Now those 4 knots, we're going to cut down 1 limb of each of those pairs, leaving us with 4 sutures. Now, in order to do our lateral row fixation, we are going to use a spanning bridge suture technique. So what we're going to do is we're going to take those 4 limbs, we're going to pull them over the rotator cuff, and we're going to take 2 limbs in each hand and pull them through the kites of the Versalok anchor on each side of the anchor. Now, then we're going to pull down the wingtip threading the suture through the anchor eyelets, and then introduce the anchor into the shoulder. Once we introduce the anchor into the shoulder, we're going to mallet down the anchor until the plastic meets the titanium. Now we're going to check if the sutures have good tension. Once the sutures have good tension, we can mallet down the anchor for the rest of the way until the laser line is flush with the cortical surface of the bone. Now, once we've done that, we'll take the Versalac deployment gun. We're going to put it over the inserter in the unlock position. Once it's pulled down all the way in the inserter, we will put the deployment gun in the lock position, and we will squeeze the trigger until the silver handle touches the black handle. Now once we have done that, we can release the deployment gun, unscrew the inserter, and check the tension on the of the rotator cuff coming down the humeral head. So you want to make sure that the rotator cuff is tacked down on the humeral head and attached on the greater tuberosity to give us the most anatomical repair possible and have the most bone tenon interface. So we will do that with a probe. We'll go in with a probe and check the tension of the rotator cuff. Once we're satisfied with the tension, our repair is complete. Now this is Yannick Ryring with Empire Surgical. Those were the basic steps of rotator cuff repair. Hope you enjoyed watching the video. Any feedback is appreciated. Have a good weekend.